Today we are going to discuss our new unit, Clinical Refraction from American Academy of Ophthalmology Optics Unit. All the definitions are very important. As I have already told you, amplitude of accommodation is most important. Retinoscopy is a manual objective method of determining the refractive error. This is not the subjective method. This is very important. This point has been asked already. Nothing is important in the introduction. Minus render and the plus render terminologies are important. Here the minus render for opters and the plus render, these are important. Examination of room length, this is important. 20 feet, and when the distance is decreased like 10 feet, we read this. Retinoscopy, you have to give the read to the whole retinoscopy topic. Most retinoscopes streak projection system. An important point. Please read what is written under the diagrams. Different type of retinoscope. Half mirrored like these. Important. Concave mirror and plane mirror effect. When is the concave mirror effect? When is the Copeland retinoscopes? Please read these things. A very important point, straddling. The axis can be confirmed through a technique known as straddling. Very important. Has been asked 2 or 3 times. Fogging and fixation. Again, very important. Aberrations. Very, very, very important. Scissor reflex. It has been asked 2 or 3 times. In which condition irregular corneal astigmatism, keratoconus, corneal or the lenticular opacities, spherical aberrations. Read this as well. Pseudo-neutralization, very important. Present in high myopia. Look here, severely myopic eyes. First few lines are very important. Read this and remember that this is present. Okay. Read, read this that what is especially important in hyperopic refractive errors has been asked. Subjective refraction techniques. Remember that subjective refraction techniques, remember their names, stereoscopic slit, and this is asked again and again. Cross standard technique is a subjective method technique. As I have already told that retinoscopy is an objective method. Read the whole topic of cross-slender from here and as well from Elkington. Also did the duochrome test. Alternate this is important. Only a read through prism dissociation. Cycloplegic and non-cycloplegic refraction. Very, very important. Over-reflection. Very important. Okay. What are the problems that can be avoided when the patients are over-refracted? Some of these problems can be avoided if highly emmetropic eyes are refracted over the patient's current glasses. Over-reflection. Okay. But there are some things which are not avoided even with over-refraction. So please remember this. This is very important. That was all about this unit. Read the chapter exercise as well.